recognizing my place as an African American academic surgeon, I knew that it was very likely that I would have to be a microphone to our community to talk about what this vaccine means, its effectiveness, its potential side effects, just to amplify how important it is. It's not uncommon for my home church to reach out to me on healthcare issues, and I knew that this would likely fall in that category. So I would say that following the two trials, both the Pfizer and the Moderna, very closely, I know that it was done in an appropriate fashion, and many of us would speak to that. Amongst those two trials, in conglomerate, about 38% of those that participated in those initial clinical trials came from the Black and brown community. So that's a good number. That's fairly reflective of the U.S. Demographic. So that's one thing that I tell my patients, or I tell people out in the community that ask me about it. Additionally, I'm fully vaccinated, and I tell them my journey as to, one, why I wanted to receive the vaccine, and two, how I felt soon thereafter. I want to help provide a very authentic depiction of what it's like to get the vaccine. Thankfully for me, I kind of breezed through the experience, but I will tell you many of my colleagues did have some of those minor side effects. But very thankfully, within 24 to 48 hours, they were all feeling right back to normal. And it was reassuring to all of us that when that happens, that your body is just revving up, building the antibodies to fight off future exposure to any COVID-19 virus. I will say that I love serving as a resource to these communities. I understand the incredible impact that these disparities are having on the Black and brown community. I feel as if I'm blessed to be in this position, and although I enjoy doing it, I also feel somewhat obligated to make sure that I am not only carrying out the care that I do patient by patient, but also more broadly reaching out to the communities that unfortunately have been marginalized in some fashion. Many of us feel as if healthcare is not just a privilege, but it's a right. And as a component of that, I'm getting out there in my community to my utmost in order to help remove some of the misconceptions around what provision of care is, and also to help improve access to those that are strongly desiring to receive it.